Welcome to A Journey to Whole Woman Health, the podcast where science, mental health, and faith come together to educate, empower, and encourage women in every season of life. We are your hosts, Dr. Jamie Irwin, board-certified OBGYN,
and Dr. Mary Catherine Nader, licensed professional counselor with a PhD in counselor education and supervision. Jamie and I have been friends for over 30 years.
Each week, we explore the intersection of body, mind, and soul, bringing you evidence-based medicine, meaningful conversations about mental health, and stories that remind us we're not alone on the journey.
So take a deep breath, settle in, and let's begin the journey.
Welcome back to A Journey to Whole Woman Health. We are so delighted today because we have our very first guest in studio recording a very special episode. We're going to get into some hard things today. We're talking about infertility. We're talking about pregnancy loss. We're talking about hope. And I'm so happy to introduce our guest, Julie Davila. Julie was first a friend that we met through Young Life Ministry here in Fort Worth. We're going to share more about what Young Life is and highlight it at the end of our episode as a nonprofit that is near and dear to both of our hearts. Right, Mary Catherine?
Yes, for sure.
So Julie has a background with Young Life. And then in more recent years, she is actually my patient. So in light of that, and to, of course, uphold all the principles of HIPAA and privacy, as her doctor, I'm going to let Julie really lead the way on any personal health information that she wants to share. And my questions will really be directed more about her story, her journey, and I know we're all going to learn a lot, and I know that you have so much to offer for all of our listeners. So welcome, Julie, and I'd like you to just get us started. What do you want our listeners to come away with? What is the overall message that you think they need to hear from you and your story?
Thanks for having me. I think kind of a summary is just to that we're not promised really anything. We're going to face hard things. All of us are. And mine for a season was infertility, and there will be something else after. And you know, scripture says that we're going to face hard times, and that we should cling to our faith. And sometimes that's easier to do than others. But my story is my story, and somebody else struggling is going to have a different end to their story. And so I think finding your people, clinging to Jesus, and being ready for what the Lord has for you.
That's right.
Is what I would share.
I love that.
Yeah.
I love that. Well, let's get into it, girl. Tell us about your story. Start really when you and Andrew decided you wanted to start a family.
Yeah, so a couple years after we'd gotten married, we decided that we were going to start trying to have kids. And we had just bought a house that had several empty bedrooms and in a great neighborhood with families, and, you know, no indication that anything would take a long time. And so we tried for a couple years, and we sought out some doctors here locally and had some tests done. And basically the summary was that we had unexplained infertility. There was nothing that they could pinpoint at the time that was hindering us from getting pregnant. And at least in my story, I went to a doctor and they, you know, shared XYZ, and we were like, okay. And then we went to a different doctor and we were like, that doesn't really jive with what we're trying to do. And so we kind of sort of trial and error, figuring out the best way to go. And we'd both been tested and had some things to work on medically, but there wasn't a big glaring thing that was causing our infertility. We actually did a few IUIs, and we did a small IVF cycle here locally that was new, and they convinced us to try it. And so we tried it, and they took eggs from me and sperm from him, and they put it in a device. It's called effortless IVF, which is not a great name for it because it did take effort.
Right. There's a lot of effort.
Yes.
There's so much effort.
Yeah. They got plenty from both of us and put it together, and then they put this device back inside me, and I become the storage for 5 days rather than a lab. And that's supposed to help regulate temperature and all that.
Okay.
So several $1,000s into that. After the 5 days, they took the device out, and we had 0 embryos. It was terrible.
Yeah.
And what was the hope? Like, obviously not 0. So what's a good number after that process?
I think they took 14 eggs from me and enough sperm, and I mean, we were hoping for a couple healthy ones. Yeah. And
2, 3,
yeah,
5 is possible.
Sure.
And you got 0.
And we had 0, and there wasn't really any explanation from that clinic as to what happened. And that was devastating because, you know, we'd spent a lot of money and time, and it's hard on our bodies and all of those things. And so that was when we took our first break because it was devastating to us. That's probably the lowest part of our journey in growing our family. We had thoughts of like, are we not supposed to be married to each other? You know, and then crazy thoughts like, what if we're somehow related? You know, I mean, we spiraled like a lot of people would, I think. And so we needed to take a break, and we did for a couple years.
Let me just jump in real quick for our listeners. So unexplained infertility is essentially you can't figure out what's going on. Mm-hmm. And it's the most common type of infertility. And I imagine the hardest to deal with and to really kind of process. And not that you ever want something wrong with you, but when there's something you can put your finger on and hang your hat on it, you can address it and you can fix it theoretically. Right. And when I'm having conversations for patients in my office who have been trying to get pregnant without success, there's a few things that come up, and I try to just make it pretty simple and straightforward, as I try to do that in all parts of my life. But it essentially takes 4 things to get pregnant: an egg, a fallopian tube, a womb, and a sperm. And the workup is then directed toward one of those 4 things in figuring out if there's a problem. So is it an ovulation problem? Is it tubal factor because the tubes are blocked from scarring, or you only have 1 tube because you had an ectopic pregnancy and had it removed? Is there a septum in your uterus, or a unusual shape to your womb? Or is the sperm low numbers, not swimming, not normal shape, morphology? So that's really how we categorize and organize our thought process, as we approach fertility. And then if we can't find an issue, then we just say, okay, well, it's unexplained. So that's where you were.
Mm-hmm. And I'm one of those people that I'm pretty type A, and I go by lists and stuff, and like, oh, if there's something wrong, then I want to fix it. I wanted the thing that was wrong to be fixable, and in this case it wasn't. Like you said, like there was nothing that I could do or my husband could do to just make this work.
Mm-hmm. And how old were you about this time, if you don't mind me asking?
Yeah, mid-30s, I think.
Okay.
Yeah.
Talk to us a little bit more just about the mental health side. You mentioned a few of those thoughts that were really hard to navigate. I think those are so common, and people just really don't talk about them because they're hard and they're uncomfortable and they're scary. Mm-hmm. What was that like for y'all individually as a couple, and how did you navigate that together and individually?
Yeah. Well, at this point, we had already tried for several years, and so this was the next thing, and we had kind of put our proverbial all of our eggs in that basket, and so we were just, well, this is going to work. Yes,
right.
Literally.
Yeah. Yes. So you put all your eggs in that basket.
Yeah. And we'd spent a lot of money, and so we were just
and time, and effort, and taking off work.
Exactly.
And, yes.
No one said it was a guarantee.
Right.
We just went in thinking, oh, this is going to work.
Mm-hmm.
And then when it didn't and we were crushed, the mental health was the key thing that made us take a break, because we knew we needed to stop for our own mental health, and to be healthy, to decide what was next, if there was a next step in growing our family. We'd been to counseling. We sought out professionals that could help walk us through what we'd been through and the feelings that we'd had, because we had never had those feelings before. Right. It was uncharted territory for us, and if we had known what the outcome would have been, we wouldn't have done the process. And so our odds were, like most people, I think, like, let's go for it. So we were counseled to take a break because we needed to focus on ourselves and our marriage, and get past those thoughts of, should we even be married to each other?
Right. What helped you during that break? Is there anything that you would want to share?
I think just continuing to talk about it with one another and how it made each of us feel. I'm not a real big feelings person. My husband is. And so I'll just talk about something else. And that's not healthy in those cases. So just continuing to talk about it and walk through it and cry together and pray together. And because it really was just the two of us that were going through it. And so there were outside people that tried to help, and it was all well-intended, but at the end of the day, it was still just us. And we could have stopped it at that point and said, we're done. You know, the Lord has closed this door. And there were times during that period we thought maybe that's what was happening. And we would have to come to the realization that we would have to be okay with that.
Yeah. Good for you guys for navigating through that. That's difficult.
Yeah.
I've had patients share with me that they really struggled with, if this doesn't work out, if I don't become a mom, I don't know who I am. Was that part of your story at all? Did you go through those emotions?
I think I have sometimes put other things in place of that, almost as in denial of that desire that I had for so long. And then when it didn't happen and didn't happen and didn't happen, I had to come to the realization that I'm gonna be okay. Deep down, I'm gonna be okay if this doesn't happen. You know, I'm still here. I'm still a woman. I'm still married. The desire was still there, but I often prayed, Lord, if this is not your will, take the desire from my heart. And I waited for that and prayed that would happen. And I wrestled a lot with the Lord in this journey. Yeah.
Beautiful.
Yeah. So what happened next?
I actually found a new doctor and way of medicine that was, it's called NAPRO. And I found a doctor out in McKinney who practiced this kind of medicine. And the first time I met him in the office, he looked over my history and he looked at me and he said, I'm 80% sure that you have endometriosis. He had not done an exam on me or anything. And I was like, what does that mean? We're X amount of years into this and I've never heard anybody say that. And for the first time, I had a doctor that took the time to sit and listen and look at my file and look at all the things that we'd done. And I had all the symptoms of endometriosis, but no doctor prior had ever mentioned that to me. And so the only way at the time to know if I had endometriosis was to do an exploratory surgery. And so in 2018, I had a surgery. He went in and looked. It's robotic, and it was everywhere inside me. And so there was so much of it that he couldn't get any of it in that exploratory. He said, we're going to have to come back and do this again. And so I had an excision surgery in 2018 and had stage 4 endometriosis. It was everywhere, all over everything. And I had grown up with painful cycles that put me on the bathroom floor a lot, and just took medicine, and doctors said, take the pill and it'll go away. And that's how I grew up until I knew the cause of these symptoms.
I found out recently that it takes 8 years on average for a woman to finally receive a diagnosis of endometriosis.
Oh my goodness. Why is that?
So, what Julie said, I think we've got to do better as physicians, as OBGYNs. And I think we are. And thankfully, you know, well, hopefully we will start seeing better care, you know, quicker diagnoses. And I think it starts with listening. Listening to your patient. The patient will tell you what is wrong with them if we would just listen and hear them and really try to put all the pieces together. And again, there's a lot going on, right? Doctors are busy, therapists are busy. We only have so much time, and there's a lot of bureaucracy. There's quotas to be met and all of it. But I think listening to your patients, it's a big lesson, a big takeaway.
And in the long run,
here.
I mean, that actually saves time because you're listening, and then they're not having multiple appointments for things that are wasting time, you know, taking that time to really listen.
Well, and in the fertility world, time is eggs.
Sure.
Yeah.
Right.
As we age, we are losing eggs all the time. Every month, we're losing them. So time is so important.
Yeah.
So 2 surgeries now, stage 4 endometriosis. What's next?
At the time, I had completely, after that surgery of the excision, I felt like a different person inside. I mean, physically. So I knew I had done the right thing. I knew that I had endometriosis, and with it out of my body, I felt like I had this new lease on life, separate from the fertility part, which I've told people, if I never got pregnant, I would still have gone through that. It was a hard surgery and a hard recovery, but the effect of it was incredible. My husband and I also changed our diet pretty drastically because it's an inflammation. And so we eat a low inflammation diet because the endometriosis can come back, there's symptoms, all of that. And because of the way I felt, I wanted to continue to feel good. So we had kind of reached the end of the road with that doctor, and he was closing his practice, and another clinic opened here in Fort Worth that kind of did the same thing. So he referred me there, kind of got established with that practice and that doctor. And then we kind of had another setback and closed door. This was in 2021. This new doctor wanted to go in for herself and kind of see, because I had started to get pain back, and I thought maybe there was some adhesions or scar tissue. And again, the only way to know was to go in and see. And so we had scheduled another surgery with this new doctor for her to see. And I went in for my pre-op and tested positive for COVID.
Oh, no.
And so I had to reschedule that surgery. Rescheduled it, and the day before that surgery was supposed to happen, my doctor had a family emergency, and I had to reschedule again. And so then the third time we rescheduled, right before my surgery, that doctor left the practice and resigned. And so that was 3 no's, clear no's.
Did you feel like the Lord was shutting those doors?
At the time, I really didn't, but my husband did. He said, no, we're not doing this. There's a reason we're not supposed to be doing these surgeries right now with this doctor, with this place, whatever it is. That's 3 no's in a row that were out of our control.
And pretty
significant.
Yeah.
Yes.
Pretty dramatic. Like,
Right.
Yeah.
Huh.
So that was really hard because, again, we'd worked all the way up to that. We were ready for surgery, and then the door was slammed in our face. And so we stopped and just pushed pause again because we felt like the Lord said, no, not right now.
Okay.
And I didn't have a doctor because she had left the practice and left practicing completely. And so might as well stop because we have to go somewhere else. So the next year in 2022, I got connected to a doctor in Dallas who agreed to look at my case. And I had an MRI, and she saw some stuff on an MRI that made her want to go in and look. And so in 22, I had a third endometriosis surgery, kind of exploratory. She did some cleaning out, but there was not a lot in there. I had started to get pain, and it was a combination of scar tissue and some other things, but it wasn't a drastic surgery that was done. And then we were like, done. No more surgeries. We're just going to see what happens, because I wanted to keep my quality of life in the way that I felt post-surgery. And so we continue now to eat the way that we do. And the surgeries and the excision was so worth it for the way that I felt.
Good.
Every month.
So at this point in the journey, it was really about not being in pain.
Right.
And the focus was not on getting pregnant.
Right.
Is that true?
That would have been a byproduct of the way that I felt, because that was so drastic that it was worth it to me.
Got it.
And if the fertility thing ended up working out, great.
Yeah. But you weren't seeking out intrauterine inseminations.
Correct.
Or thinking or exploring more in
No.
vitro. It was just, I don't want to
Feeling
be in pain all the time. And,
Yeah.
and for our listeners who aren't familiar with endometriosis, it is a pain syndrome. And the process, at least the theory that's most widely accepted, is that inner lining of the uterus, that endometrium, instead of coming out with your period as it does, in some women, there's likely a genetic predisposition, because we do see it run in family lines. The belief is that there is retrograde menstruation, meaning that endometrium layer goes backwards out of the tubes and into the pelvis. So the most common location is onto the ovaries. You can have foci of endometriosis on the ovaries, but you can have little ditzels of it, little pockets, foci, land on the bladder, on the bowel, anywhere in the pelvis. So then during the period, instead of the cramps and the inflammation being localized and contained within the uterus, you now have a whole pelvis full of inflammation and cramping, and that causes scarring. It can close off tubes and really can just cause this really kind of inflammatory pelvis that can affect fertility.
Mm-hmm.
It sounds so painful.
So pain with periods, pain with intercourse, pain with bowel movements, and like Julie mentioned, like debilitating on the floor in the bathroom, missing out on school, work, activities, just feeling like you are not engaged in your life because the pain is so severe.
Mm-hmm. And I don't know if it's because of my age, but when I was growing up, nobody talked about endometriosis. Nobody mentioned that was even a thing. I was just medicating. I was just medicating the pain.
Yeah.
And that was my normal. And so when that didn't have to happen after the surgeries, I felt, it sounds drastic, but like a new person.
Yeah.
Sure.
So.
Good. So you got to where you were feeling better.
Yes. I started feeling better back in the first endo surgery, and then pain would start to come back, and I'd be like, I think there's something in there. So, yeah, that was in 22. And I felt good. We were ready to figure out what was next. We were going to plan the rest of our lives, the two of us. And we actually sold that house with the empty bedrooms in it right before COVID, and built a new house. And we built our house for the life that we had at that point. We decided, whatever's going to happen is going to happen. We're going to build a house, and we'll see. We don't need all these extra bedrooms. We don't need all this space. We're going to build a house for what we need today. And so we did that during COVID. And it felt kind of like we're going to close that chapter and start this new one and plan our lives, the two of us, because that's what the Lord has for us. It's evident.
Close the chapter on having children.
Yeah.
Okay.
Yeah. Because we had tried, we'd spent a ton of money, we'd done all these things, and it just hadn't worked. And so we were going to just move on to the next thing and plan a life without our own children, which we had come to terms with at that point, because of all the time it had been. And that was we were okay with that. That was just fine for us. It was not what we wanted, but we became okay with it. And then in early 2023, I had a positive pregnancy test. And I think you were the first person I maybe texted before I told my husband. I said, "Are you accepting new patients? I just got a positive pregnancy test." And
this was your first positive pregnancy test of
yes,
your life.
of my whole life.
That gives me goosebumps.
Yeah.
How cool.
How old were you?
39, I think. Yeah, 39 in early 2023. And I set up this whole thing for my husband when he got home from work and videoed it. And to say he was shocked is an understatement. I was too, obviously, when I took the test. Because I had pretty regular cycles. So a few days, 5 to 6 days late, I began to wonder, but also thought, there's no way. There's no way. Well, there was a way. I was pregnant. And sadly, that one ended in a miscarriage before we got a heartbeat, and I had a DNC. And then later in 2023, I had another positive pregnancy test. And at that point, we were like, is this a cruel joke? I mean, something's working. We're just not getting to where we need to go with these pregnancies. And so that second one also ended in a miscarriage and had a DNC. And genetically, both of those pregnancies didn't continue for different reasons. It wasn't, copy and paste. It was two different reasons. Genetically not viable. And so we didn't get a heartbeat with either one of those pregnancies. But we had this renewed sense of hope in, okay, maybe this could work. Maybe there's something we can fix. Maybe there's some tweak. Who knows? Because we've never gotten this far. And to even get a positive test was like this light at the end of the tunnel that had kind of gone out and we were okay with, started to flicker. And we hadn't really done anything different. I truly think it was timing. The Lord said, here you go. And we had not prevented in years. And so it's possible it could have happened, and it did. And I'm no stranger to surgery, so the DNCs were hard, but not terrible. And because we hadn't even gotten to a heartbeat, I think that made the recovery and the mental part of it a little better. I don't know, but it was a life and we created it, but it was so quick and so unexpected for us that it was almost like, I don't know. It wasn't as hard as I have heard miscarriages can be for people. It was still very hard. And there were times we were angry at God.
Yeah.
You've talked about that as a physician, like, why did this have to go this way? And we're not in control of any of this as humans, and we just put our faith and hope and trust in the Lord orchestrating our life. Thankfully, we don't have control.
I know I was angry at God. And that's something I had to wrestle with.
Yeah.
And not just with you, other patients as well. And at the end of the day, I have to realize I'm not in control. I am not God. This sure doesn't make any sense to me. Here I see this beautiful couple who love each other, who have a life that they can provide this child in a home full of love. And this is the desire of the heart, and why isn't this happening?
Yeah.
And why is it happening this way? Like, either close the door or don't, man.
Right.
Like, come on, because this is devastating.
Yeah.
I mean, it was for me, and I'm not you. I'm not just your doctor helping you along here, but I was angry at God.
Mm-hmm.
Like, this cannot be the way.
Right. And there wasn't anything that we could do or that we could point to or fix, or again, if there was something to fix, I would fix it or change it or try it or whatever. And there just wasn't for us. It just was the way the Lord had decided to do it.
Yeah. Well, I think this is a great place to pause. I love how you mentioned that the light had gone out, and now all of a sudden there's this glimmer of light that's starting to come on. So stay tuned. We're going to bring you part 2 of Julie's story, infertility, pregnancy loss, and hope. Join us next time. This episode, we'd like to highlight Young Life. Young Life is an international, non-denominational Christian ministry focused on mentoring adolescents through building personal relationships, organizing fun activities, and sharing the gospel. For more information and to get involved, visit younglife.org.
Thank you for joining us on a journey to whole woman health. If this episode encouraged you, share it with a friend, leave a review, or subscribe so you don't miss future conversations. Remember, your questions matter, your health matters, and wholeness is a journey. Until next time.
Now for the legal language. The information shared in this podcast is for educational purposes only and is not intended as medical or mental health advice. Listening to this podcast does not establish a doctor-patient or therapist-client relationship. Always consult your own qualified healthcare provider regarding any medical concerns.